Here to discuss, Randi Weingarten, president of the American Federation of Teachers, which also represents healthcare workers, and Dr. Vin Gupta, global health policy expert, pulmonologist, and MSNBC medical contributor. He also serves as a public health advisor to the AFT. Dr. Gupta, what are the real health impacts of these funding cuts?
Alicia, great to see you. And as Randy's going to detail, what we're going to see here is many millions of Americans lose coverage to basic primary care. And it's hard to make America healthy again. This new rebranding that we're seeing from the new health secretary, if people do not have access to basic fundamental primary care for cancer screenings, for their basic chronic disease screenings, it's impossible, but that's what we're seeing. And this is not a political issue. 82% of Americans oppose cuts to Medicaid. And what we're seeing is that this is going to affect red states, frankly, more than blue states. And as a pulmonologist, I see the impacts of this every single day when I practice medicine in an ICU. People rely on Medicaid access to get access to care in safety net hospitals for mental health care services. And then ultimately, if they need hospitalization because they have a severe incident or a severe medical disease, to cover that. And this is at risk.
Randi, what are you hearing from your members, many of whom are nurses?
So, we're now, first off, thank you, Alicia, for having us on. We're now the second largest nurse union in the country, and we represent lots of nurses who work in really, vitally important hospitals that rely on Medicaid. Take downstate in, the middle of Crown Heights, Brooklyn. 80 to 90% of its patients are Medicaid eligible patients. Rural hospitals across the country, we've already seen them close. So when you talk about all the cuts, you're talking about the cuts to the ACA, the cuts to Medicaid. You're actually talking about 13 million people losing their health care. You're talking about elderly folks who are in long-term assisted living losing access to that. What are their kids and grandkids going to do? You're talking about kids who have long-term disabilities losing their health care. You're talking about others in a place, take Josh Hawley's state, 1 million people. He said it is morally and bankrupt, in the New York Times, to take away this health care. So ACA and Medicaid have really become the foundational health care for millions of Americans, 70 million Americans in the United States. This takes a hatchet to that, regardless of what anybody in the Republican Party is saying. You take that many dollars out of it, you are actually stripping people from care, and people will die.
It is always so interesting to me, Dr. Gupta, that because of this type of push, you end up in a defensive crouch where we have a conversation where we need to remind people about the value of Medicaid and the value of having a social safety net. If we were in an alternate reality where we were instead having a legitimate conversation about making America healthy, I'm not sure that America was ever healthy to begin with, such that we can make it healthy again, and expanding that social safety net and actually giving access to more people, what would that conversation look like? And just how far are we, Dr. Gupta, from the conversation we need to be having?
We're really far from it, Alicia. I mean, I appreciate the tee up, appreciate just this conversation, because, I mean, to Randy's point, American Federation of Teachers is not just a teachers union. It represents healthcare workers like me and the nurses that I work with. But to your point, we're not having the conversations that we should be having, because we don't have the attention spans, at least at scale, to have those conversations. I think about what patients ask me often about outside the ICU, which is, hey, what about this weight loss drug that I keep hearing about? What about durable access to that? And we're not even talking about reimbursement mechanisms or ways in which we can increase access to something like that. We're talking about an executive order to lower prescription drug pricing, but that's not going to fix it. We need to build on what the Biden administration did to lower prescription drug costs, not issue executive orders like we saw yesterday. And so we're very far from that. We're very far from talking about automating things like prior authorization, getting people the care they need without step therapy. That's something we don't talk about. And frankly, there's still 13% of the of Americans across the country have no insurance whatsoever. What do we do about them? How do we keep them out of urgent cares and ERs and ICUs? That's what we need to be talking about. How do we thoughtfully expand Medicaid? Not how do we break it down. To Randy's point, how do we put more people vulnerable and put more people at risk? We're not having those conversations.
Right, and to your point about that executive order, he wants the same drug prices we see in other countries where the government is the one negotiating those drug prices, where the fundamentals are just absolutely different. Just really quick, Randy, you sent a letter to the House Energy and Commerce Committee. That's one of the committees that was engaged in markups just today. What did you want to impart to them as they went into that markup?
Just the specifics of the harm that will be caused by these cuts. I mean, Dr. Gupta said it. We should be talking about how to increase the safety net, so not how to decrease it. If the only medical care that you get is from an emergency room, and that urgent care has closed or it's hours and hours away from you, how are we going to keep kids healthy? How are we going to keep our parents and grandparents healthy? This is about a fundamental right of life, and that's why we're fighting it so much.
Randi, Dr. Gupta, thank you both so much for coming on and for being with us. And when we come back, some federal workers who were fired in the DOJ cuts can return